NHS National Health Service. The government would now guarantee the right to access to doctors, hospitals, opticians, dentists, pharmacists, medicine and other services funded by taxes. Before this, people had to pay. Nye Bevan, the architect/father of the NHS, stated that illness is neither an indigence for which the people have to pay nor an offence for which they should be penalised, but a misfortune that should be shared by the community. Opposition to the NHS. The Conservatives objected to the cost. Doctors thought they would be paid less, restricted freedom to choose to treat, and councils lost control over their own hospitals. British Medical Association, the group coordinating doctors and health workers in Britain. They surveyed that the NHS only had 10% of doctors in favour at the time. Winston Churchill was the Prime Minister during WWII and leader of the Conservatives. He opposed the NHS, calling it a curse on the country. Compensation for cooperation. Paying someone for their loss. Bevan had to compromise and allow doctors to keep some paying patients, hire their own beds in private wards. Bevan said he had stuffed their mouths with gold to reach a compromise. Regional boards. When small groups of hospitals work with local authorities providing hospital access, ambulances, vaccinations and a range of other services. Usage rate. By 1949, 95% of the population were enrolled and 88% of doctors and 95% of dentists had joined. Government spending. The amount the government spent, measured by year, the NHS became the second most costly thing in the budget. Between 1949-50 it cost £228 million, 8.5 million dental patients were treated and 5.2 million pairs of glasses dispensed. Prescription. When a doctor prescribes a patient medicine, between 1948-49 187,000 were written, with the cost being covered by the government. Subsiding. Paying part of a cost. Subsidies were introduced for some things with the NHS glasses, spectacles in 1951 and £1 for prescriptions dental treatments in 1952. Positive indicators. Things that showed the NHS was working. Infant mortality dropped, deaths by TB and a range of other fatal diseases were all decreasing too. Dual system. The healthcare system developed two strands, a public one and a private one. This was a compromise for Attlee and Bevan. Political views. Conservatives thought the NHS was costly and inefficient, whilst Labour believed it was necessary and world-leading. Preventative care. As time has moved on, the NHS has focused on reducing the cost of care by trying to tackle problems using public health campaigns, smoking, healthy eating, lowering alcohol consumption, exercise. AIDS. Acquired immune deficiency syndrome, identified in 1991. This attacks the white blood cells in the immune system and stops the body being able to fight off diseases, and infected people can die of things like colds. Freddy Murcury was the lead singer of the band Queen. He died of AIDS in the 1990s. Transmission. The way a disease is spread from one person to another. With AIDS, this is usually through sex, sharing drug-related equipment, or previously infected blood transfusions. Mitigating medicine. There are medicines that can treat the symptoms of AIDS, but not yet anything to cure it. This means those infected have to live with the disease until the end of their lives. Funding crisis. People are demanding more and more of the NHS in terms of technology and service. However, the Conservative government put austerity in place in 2010 and funding hasn't improved much, meaning the NHS has had to cut services.